Hello, and welcome to the Care Machine Sustainable Healthcare Podcast. I'm your host, Professor Helen Mees. The dissolution of NHS England marks a historic turning point for the UK's healthcare system, one that could fundamentally reshape the landscape for sustainability and the NHS Greener Initiative. As traditional structures give way to more distributed, regionally empowered models, the mandate for sustainable practice is more urgent and complex than ever. The NHS Greener Initiative, initially devised by a central authority within NHS England, faces the future possibility of relying on the commitment, innovation and collaboration of local trusts, suppliers and clinical leaders to achieve ambitious carbon reduction targets and embed sustainability into every facet of care delivery. Whatever the NHS is to become over the next 10 years presents both significant challenges and unprecedented opportunities for the net zero movement across the organisation. On one hand, healthcare organisations must navigate evolving compliance requirements, new public reporting standards, and the integration of sustainability metrics into procurement and clinical assessment. On the other, there is the possibility for greater flexibility, tailored solutions, and community-driven innovation, empowering regions to address unique environmental and operational needs while sharing best practices nationwide. The future of the NHS Greener Initiative will be defined by those willing to lead: engineers designing low-impact medical technologies, clinicians championing greener pathways, and policymakers forging standards that balance quality, cost, and environmental stewardship. In this episode, we explore the impact of the NHS Greener Initiative over the last 5 years, how it's reshaping the sustainability agenda, what actionable steps organisations can take now, and why a collaborative approach is critical to delivering on the promise of a net zero NHS in a post-NHS England era. My guest today is James Dixon, Associate Director of Environmental Sustainability at Newcastle Hospitals. He's a chartered environmentalist with over 20 years of progressive environmental sustainability leadership experience across complex UK public bodies, including local government. He's well regarded across the healthcare sector for his ability to translate national environment and climate policy into strategies to deliver impact and operational improvements, which bring added benefits of caring for people and the planet. Beyond the NHS, he is an active member of Healthcare Without Harm Europe and has been Vice Chair of the Board of Directors for 5 years, as well as chairing numerous regional and national sustainability and environmental groups. I began by asking James about where his love of the environment stems from. James, welcome to the Care Machine podcast. It's a real pleasure to have you on the episode.
Thanks for having me, Helen. Appreciate it.
In my introduction, I talked about your extensive career in the sustainability sector, but that's not just something you've fallen into, is it? Going right back to your degree days studying environmental studies, this is really part of your DNA. So what led you to a career in sustainability and particularly the NHS?
Well, so I grew up in rural Northumberland and I've always loved the outdoors, playing, exploring, camping. It's kind of what you had to do in the 80s in rural Northumberland. And I've been brought up to respect the natural world. So I think that was firmly rooted in me. But in terms of career, I'll be honest that I didn't know what I wanted to do whilst I was at school. I chose the subjects I was interested in, so geography and biology, but then I didn't really have an idea of a clear route beyond that. There was no one in my family that had been to university, for example, so it wasn't guaranteed or even thought about. So did kind of fall into that, Helen, a little bit. So I put down 6 different unis, 6 different courses for my UCAS forms, and was even considering Sandhurst, believe it or not. So that was how I really didn't know what I was doing. But then I met my now wife in that summer, so I had to make a decision. So chose one closer to home. It was a computing degree at Northumbria University, actually, and then I could see from the first day that was the wrong choice. So I quickly contacted the course leaders Mike Jeffries is now retired, but we're doing some work with him, ecology background on the hospitals. More on that later, potentially. And he convinced me that I could switch over to do environmental studies. So that was quite fortuitous. But after that, very much I was on that track. So environmental studies was a great foundation for us. Couldn't get a job after my degree, so was lucky enough to get a bursary for an MSc locally at Sunderland, doing environmental management and health and safety, and then a work experience course that got me into a role at Newcastle Council. And then in terms of the NHS, I was doing a good grounding in local authorities in Newcastle City Council, because they had a lot of services. I was doing the environmental auditing as well as the implementation of their environmental management systems. So as an early professional, that was brilliant, because I could be looking at the impacts of grounds maintenance or a leisure centre or town and country planning. So it was fantastic. And then the NHS wasn't really on my radar. So for those who are listening or maybe in the same circumstances in me, early stages, the NHS is the biggest employer in the UK. It's something like the fourth or fifth biggest in the world. But for some reason, it was not on my radar, because you just think nurses, doctors. So a friend of mine had given me a nudge that there was a waste officer role at Newcastle Hospital, so waste focused, and got interviewed that and was successful, and then was able to expand that role because I was interested in sustainability. They weren't doing anything else, so a bit of a one-man band at the time, but yeah, so that was my rapid journey. But I'm pleased, and I'm really lucky, because a lot of my friends and peers have done subjects or degrees that they haven't been able to continue into their career, so I do count myself lucky, definitely.
Yeah, I think I can safely agree with that as well. In my own career, being able to, be an engineer over the last 20 years, it's an amazing opportunity, and it's lovely to hear your story as well, because it just goes to show that you never know what doors are going to open to you, do you? And particularly in this now need for creating sustainable opportunities within large businesses such as the NHS. This is crucial work right now.
Yeah, definitely. And there wasn't really that kind of career path or that expertise within businesses. It wasn't seen as a priority. Some forward-thinking businesses might have had environmental professionals in. Now it's much more common. So the opportunities are there. And also it talks to some of the values sets of some of the younger generation coming through. They want to see their employer taking this seriously. So it's great as a fellow of the Institute for it's changed its name, Sustainability and Environmental Professionals. It used to be IEMA, Institute for Environmental Management and Assessment.
Yes.
We're seeing that come through now. So the interest in the profession is fantastic.
Well, you've spent the last 15 years in the NHS, and you're now Associate Director of Environmental Sustainability at Newcastle Hospitals. What are you seeing as being the biggest challenges facing the healthcare sector, particularly in terms of sustainability?
Well, the UK health sector is public, so it's quite politicized with a small p. So it very much depends on policy and government direction, I would say. Fundamentally, it's an institution, the NHS, that is cherished still, thankfully, in the UK. So we have to work within that context. That said, increasingly more and more people are aware that health fundamentally requires the environment to support your health. So the planet is our life support system, and if we continue to pollute it, we will see more impact on health. And that, as a business, if you want to phrase it that way, the NHS, we will just see more people coming through the door with more comorbidities and more ill health, and that just affects society, not only putting strain on a publicly funded service. But I would say the biggest challenges, certainly in my experience, awareness of the issue used to be a challenge when I started my career. I was wasting a lot of time with climate deniers or people debating whether this was either an issue or whether it was human impact. So that has moved off, thankfully, the radar. So it's no longer, people get it, I would say. So maybe some people didn't, people do. So that challenge has moved on. But two challenges that remained back then that are still true now are funding for work in this space, and also the capacity to work on the things if you did have the money. So if I just use examples locally to me, that's what I'm going to the board all the time. We've captured the imagination. They get that this is important for health. They wanted to support it. They want to make it business as usual. But we're hearing from staff that want to do work in this space. They don't have any extra time. So kind of trying to find ways of giving staff that time and capacity and tools to be able to work on this. Some people do, but they tend to do it, our staff green champions here, over and above the work that they're doing in spare time. And that's hard. That's a challenge. So you've got one of the leaders saying, yes, we just want to make it business as usual, and they should go forth. And then you've got the staff who are trying to still recover from COVID and get through the elective backlog and or having to work over and above. So then trying to bake this in is difficult. Money is still a challenge, as it always is. As a publicly funded body, we aren't funded to improve environmental impact. Some things are within our gift in that we're lucky to have environmental professionals in the team. Organisation of 16,000 staff, Newcastle Hospitals, we're big employer in the region. Small team trying to work on that. Others don't. It's still quite a new profession, and the capability and capacity in some groups of hospitals is quite limited. So those challenges financially, we need external money. And even that in NHS terms, public sector decarbonisation scheme has been running for a few years. It's recently been announced that stopped. So that was focused on heat decarbonisation in healthcare. But that gave you the grant funding capital that you needed to invest in this aging infrastructure in the NHS. That pipeline seems to have turned off. So we need to look elsewhere. But fundamentally, money and capacity. We've got the solutions, technology. You're very familiar with some of the technological solutions, Helen. They're there. We just need the government policy and the leadership to enable them, if I'm honest.
This is no longer a nice to have, is it? This is no longer a nice little plug-in that we can all sort of reach our KPIs and make our businesses look nice. This is absolutely fundamental and should be baked into our business plans and strategies now. And the NHS is no different to that, is it really? It has to have a strong strategic drive, which is underpinned by sustainability and by understanding our environmental impact. And I absolutely agree with you, that without investment, we're just not going to be able to put those level of challenges to bed. We're not going to be able to address them in the way that need to be addressed, are we?
No, not at all. It's transformational change is required. Part of the journey that I've been on in the 15 years here was we were trying to do incremental changes because there were quick wins and obvious things you can do. Now we're in the really difficult transformational change. There's still incremental bits we need to do, very basics, like there's parts of the NHS that don't have LED lighting, even in my own organisation. That's basic, but that's a funding challenge more than anything. But we need, if we're going to try and limit and mitigate the climate breakdown that is absolutely happening, we need to be making big changes. And to do that, you need policy and leadership. Absolutely.
Well, that leads us on very nicely to my next question. So for those viewers who might not be familiar with the Greener NHS programme, can you give us a very basic overview of what it's about and the goals the NHS has set themselves in terms of sustainability and its net zero programme?
Yeah, so the headline is the NHS were the first healthcare system globally to commit to net zero. And to reduce carbon emissions for the benefit of patient health. So that is absolutely the headline. Very, very proud to have played a small part in that. Our organisation, our CEO at the time, was part of the expert panel to try and think, is this possible? What can be done? And that was in very early 2020, ahead of COVID. And then even with the backdrop of COVID, they produced what's known as the Delivering a Net Zero NHS report, and that is now statutory guidance for NHS organisations. And for NHS England, this commits us to achieving net zero carbon for the emissions the NHS has control over by 2040, and net zero for the whole of the carbon footprint plus, as we call it in NHS, by 2045. So you'll notice both of those targets are ahead of the UK government's targets of net zero by 2050.
Okay. And the purpose of this really is to drive change across the entire NHS. This is not just about, as you said before, it's not just about doctors and nurses, is it? This is fundamentally changing the way that we see treatment, hospitals, the infrastructure, all of that. It's all part of this Greener initiative.
Absolutely. So we're trying to decouple carbon emissions from healthcare, essentially. So we still want to provide outstanding outcomes for patients, outstanding experience for patients, but we want to move the dial and actually get rid of carbon emissions whilst we're doing that. So yes, it's beyond just the organizations themselves. We are big purchasers, the NHS. We buy a lot of stuff and services and tech and kit. We throw away a lot of stuff, which we want to try and reduce as well. But in publishing that report, it was a call to arms of the whole supply chain as well. So we spend a lot of money, so we have a lot of influence as a big anchor organization, locally in Newcastle, but also nationally. So one of the strengths of the Greener NHS team's commitment was to signal to all supply chain partners that they will not do business with the NHS if they aren't following the net zero plan to reduce their own emissions in line with the NHS targets. And if they're not up to speed by 2030, then they will not do business. So that sent a message to the market that this is important. And they've started applying a bit more of their R&D and thinking to, if I want to protect my market share, I need to take this seriously. So there's some policy shifts that can be done just with words, backed up with some of the policies and procedures, which they have done. That's quite impressive as well. So yes, you're right, Helen. Beyond just the hospitals decarbonising their services, it's the whole ecosystem around healthcare as well.
Well, I'm very excited to say that we've got Heidi Bernard joining us in the next episode of the podcast to talk very much about the supply chain itself. So any of our viewers watching today, if you're interested in hearing about supply chain, stay tuned for the next episode. But I wanted to come to the crux of today's episode, really, which was the success of this Greener NHS programme. It's now in its 5th year since Nick Watts developed this idea. And I appreciate it's easy to look back with 2020 vision, isn't it? But do you think that we can safely say now that over those 5 years, the programme has been successful?
Well, that's a difficult question. So I can't speak for the Greener NHS team at NHS England. They would have access to more of the data, they're in a national picture, and also they're at the board level at NHS England, so they get a feel for whether this is truly landing and they're shifting the dial on it. So I can only really talk from my perspective as a provider. So we're a group of hospitals that provide services, and I'll caveat it a bit, Helen, in that I'm an eternal optimist. So I think it has been a success. And my reasoning for that, it's been a bumpy road, don't get us wrong. We've had COVID in the middle of that, which was a huge impact. I don't need to tell anyone about that. We saw huge drops in travel emissions because people were not moving, and we made this shift to virtual communications. But we've had a big bounce back after that in terms of elective recovery. So we've had to see more patients, and we've generated more emissions by developing services or buildings as well. In the back of that. Yeah. But if we're defining it on reductions in carbon emissions as a whole, they normally produce it annually, but there's been some gaps. But from the data that I've seen from a national picture, we have seen it come down. So they're still on track for their 2040 targets. There's been big shifts in procurement that I touched on just earlier, and we're starting to see the market actually take this seriously and reduce their own emissions, and then demonstrate that when we go to tender. So the value of keeping with that provider or moving to another one, we can now add net zero to the weighting of the scoring system. So there's a minimum of 10% allocated to net zero and social value on all NHS tenders. That's baked into requirement now. And also up until now, we've seen some funding allocated to the public sector, of which the NHS was ring-fenced a third of that public sector decarbonisation scheme. And that's been billions go into the NHS, as well as local authorities and schools and unis, to basically help shift the dial on their heat decarbonisation. Because one of the challenges I mentioned earlier is getting money to be able to spend it on that capital and big infrastructure. And also, I think it's captured people's imaginations. So there is something centrally. It's a focus of NHS England. It's a priority of theirs. And that was not in existence before the Greener NHS. There was a great team, people long in the tooth like me, known as the Sustainable Development Unit. But it was a small offshoot that was helping the limited amount of professionals that were trying to do this within organisations. Now it's really expanded. There's a set of expectations that all trusts have to have, a net zero lead at board level, a plan and report on that plan. So it is improving, but not enough, not quick enough. The emissions aren't coming down. There's a lot of challenges that I've already touched on of why that's not, but it would be wrong of me as an environmentalist to say that everything is rosy. So it's definitely an improvement, successes on some fronts, but maybe a B minus. Could be improved.
Right. I was going to say C plus, maybe.
yeah, maybe a debate, similar.
Yeah. I mean, it speaks to the commitment of people like yourself across the NHS when you set off with this fantastic idea in 2020 and then are suddenly hit with this wall of COVID, where we're seeing huge amounts of materials being transported across the world. We're seeing millions and millions of bottles of medicine being used and disposed of. It really does demonstrate just how committed you are to ensure that this continues, having hit that huge bump and then come back to getting it back on track. So I think you should give yourself a bit of a pat on the back, really, from that point of view. But I think certainly some of the solutions that I've been seeing coming out of not just Newcastle but other hospitals across the country have been fantastic. Just small changes are making a difference, aren't they?
Yes, definitely. It's not all doom and gloom, and I have to, because I do suffer from climate anxiety or eco anxiety. There wasn't really a word for it. I was struggling in 2018, but I have to focus on where we do have control and where we're able to make change. That keeps me mentally stable, I would say. So focusing on the areas where within our gift we've been able to do work and where we can influence and create ripples of improvement, really lean into those kind of things. Great examples, we've got a long history at Newcastle with reuse. It's still not as prevalent as we'd like, but reusable sharps boxes, our curtains, a lot of PPE is reused. That was challenged through COVID, but we were able to stand and still kind of show the efficacy of the cleaning and also the environmental impact reduction when we maintain these systems. So, and then other interventions, great work on anesthetic gases and reductions in nitrous oxide. First baby born in the UK using nitrous oxide cracking technology was at the RVI, little baby Rosie.
Wow.
And we use that as standard now. So that was a Scandinavian technology that we brought over and trialed, and now we use it. So birthing mums in Newcastle will be breathing in Entonox, which is a pain relieving medicine, but when they breathe it back through the machine, it cracks into 2 inert gases environmentally, whereas previously it was almost 300 times as bad as carbon dioxide for that planetary warming impact. So there's been some good successes. We've got to not take our eyes off that.
Yeah, definitely. Now, the biggest challenge to the Greener programme, as you've already kind of touched on, is ensuring that suppliers and the supply chain are on board with the NHS. Do you think the engagement of equipment suppliers has been, on the whole, pretty positive? And from your experience, how well are they adopting the Evergreen Sustainable Supplier Assessment?
2 things, I would say. It's been tricky to get suppliers into the detail. So there's appetite to do this and support this. They can see the direction of travel. They want their work in this space to be rewarded, so it's acknowledged in tenders and other things. But similarly, there has been pushback in my experience of some providers who want to maintain the status quo. So their market share maybe on some gases or some medicines that we know to be environmentally damaging, and there are alternatives out there that are less environmentally damaging, and they might be using their influence to try and maintain that position. I've certainly seen that myself. So there's some positives and some negatives. That said, I think the overall direction will be positive because they can see that at this point in 2030 that they have to demonstrate with evidence that their carbon reduction plans are in place and they're actually reducing their emissions. That is going to come. And that's testament to the Greener NHS team and the sustainable procurement team at NHS England as well. The Evergreen assessment, again, there was a need for a framework centrally so that suppliers could have confidence in demonstrating where they've done well. That's been no mean feat because you have, these global kind of corporations, GlaxoSmithKline, AstraZeneca, Johnson & Johnson, and then you might have a 2 or 3 man band trying to innovate and come into the sector. And the ask is the same. So it's a real challenge for the central team to be able to support that difference in supplier. So rightly, they've focused on the bigger ones because that's where all the carbon is and that's maybe where the change is. And then they're going to support smaller companies on that journey further down the line. We've taken a more ambitious approach because we like to, and as well as the Evergreen supply chain framework, we have our own net zero supplier framework at Newcastle, 5 steps, and we engage all of our suppliers and try to get them to be aware of their emissions, commit to the targets, and also produce carbon reduction plans that we can help them with, and then report their data to us. That not only helps improve the accuracy of our Scope 3 emissions, and then we can show where we're improving rather than on spend-based carbon accounting, which is a whole different podcast but has its own challenges. We're moving to actual data and then supporting small businesses. So particularly in healthcare, you'll have medicines and big pharma and NHS supply chain. So Heidi's coming to talk to you about that. But we have, window cleaners or others who are very local to every hospital trust that tend to support. And we need them on that journey as well. So we help them with some really easy reporting and templates and other bits to try and help. Because the appetite is there. We hold annual supplier events and they all come and tell us what the challenges are, and we're starting to see improvements there. So yeah, definitely a positive.
I think that sounds great that you're working not just with the big players, but also with the small local organisations that really play a massive role in your particular hospital. And I'm sure it's the same for many hospitals across the country. Now, in March of this year, we saw the government take the step to abolish NHS England, as well as launching the new 10-year plan in July. Do you think that those two very significant milestones have made any difference to the way in which sustainability and net zero is being viewed and also being applied in the service?
Well, to be honest, the fact that there's less of an explicit commitment in the 10-year plan and there's still this uncertainty around NHS England, which currently houses the Chief Sustainability Officer and the Greener NHS team. And whilst NHS England is getting abolished, there's a merger of Department of Health and Social Care and NHS England. So there's a lot of uncertainty for colleagues. We work closely with colleagues in NHS England. So whilst that is the direction of travel, it remains to be seen whether the Greener NHS team will just migrate straight into Department of Health and Social Care. That would be a good outcome from our point of view because they're still core, it's still a priority. They'll report into the Department of Health and Social Care Board with this as a priority. If that's not the case and they have to cut staff or there's less capacity centrally to be able to work on this, that will be a big threat to our progress, I would say, as a system, because we're still quite old in our ways, in that the corridors of power are still very much in London. Whitehall, there's a lot coming out of there, so you kind of still need to press the flesh and have the conversations and be able to influence. So if that is weakened, I think that's inevitable. That's going to be a challenge. The 10-year plan, it has less explicit mention of net zero or environmental improvements than the previous 10-year plan, the long-term plan. That said, there are still ways. So that's a disappointment fundamentally. I can't ignore that. It would be great to have a chapter making the explicit reference to caring for people and planet and why that's fundamental to health outcomes. But I'm clear-eyed into what the current context is politically and financially in the NHS. So there's very much a regrounding and a refocus on patient care and outcomes. But there were some, chinks of light in the 10-year plan. Health inequalities is a big part of that. Clean air, which is one of our long-term commitments in our climate emergency strategy, that's quite clear. So any work to reduce health inequalities and improve environmental outcomes, we can shout about and show the link. So it's disappointing that it's not one of the key shifts. As an environmentalist, I would have liked to have seen that there, but there's still opportunity to show the value that we're currently bringing with Greener NHS and our own provider Trust Green plans to that 10-year strategy. Absolutely.
It sounds like then that there's some opportunity for policymakers and other people, not necessarily in the NHS but outside, to put pressure on to ensure that we have and maintain this net zero programme, because otherwise, as you rightly say, it could get lost in the mix of priority changes through the 10-year plan and other things. We really do need to keep the pressure on, don't we?
Yes, and I think that the public will do that to some extent, because whenever we poll patients and visitors, or nationally there's some polls, it's always up there. Climate change is a concern, the NHS is a priority, and then it doesn't take a rocket scientist to know the two interconnections. So when that's explained, people just expect the NHS as a public institution to work on reducing its environmental impact, because they will see that will lead to wider benefits. However, the political context and, dare I say, the culture wars around some aspects of the work that we do, net zero being, a conflicting word in some circles, we've got to be mindful of that as well. So
yeah, sure.
It's disappointing, because my whole career, it seems like it's not necessarily been the top priority of the businesses or the organizations I've worked with. So we've still got that fight on our hands. Absolutely. But I think the scaffolding or the infrastructure around that is better than it ever has been. So the opportunities to put pressure on or see where the benefits are, it's better than it ever has been. But you're right. Good call to arms. Maintain the pressure and the need to have that capacity in that direction, for sure.
Well, that's the whole purpose of this podcast, is to keep that pressure on and give people access to information so that they can do something themselves to make an impact on net zero and healthcare. So we will keep cheerleading along, James, as we go through this podcast. So I guess let's look to the future then. Let's think about where we might be in 2035, 5 years away from the Greener NHS goal of total net zero. What do you hope we will have achieved by then? And what do you envisage as being some of the roadblockers between now and then? And what can people like me, engineers, scientists, clinicians, what can we be considering doing to help this go forward?
So by 2035, well, personally, for our local context, I would like to think that we have achieved net zero carbon for our controllable emissions, because our commitment is 10 years quicker than the NHS commitment of 2040.
Okay, right.
We're aiming for by 2030. And using the ISO definitions of net zero, that essentially means a 90% reduction on our controllable carbon emissions from our 1920 baseline. Now, we're currently off track with that, but that's because our energy emissions are still overshooting what we'd like to do in our carbon budget. And that links back to the heat decarbonisation, all the capital money you need for old hospital infrastructure to switch to renewable heat. So ideally, by 2035, we've achieved that goal, and we are halfway to reducing the carbon emissions in our supply chain, because, again, we're 5 years earlier than what the national targets are. We're aiming for all of our carbon footprint plus to be net zero by 2040, 5 years ahead of government. So we'll be making great progress in that space. That's what I'd like to see. For how that can actually work, I go back to one of the earlier questions around money. So it
Yeah.
it's quite flippant to say, but as a public body that is funded from the government, we aren't funded to do this extra work currently on what is asked. So we need external sources of grant funding or ways that the government can unlock other innovative ways of getting finance into the NHS. Another thing in the long-term plan, or the 10-year plan, sorry, is this opportunity with good controls to maybe get some partnership in from the private sector to invest in either integrated health networks, which is one of the key asks within the plan, but also potentially around net zero infrastructure. So there's a little carrot there that I'd like to see explored. Now, the worry politically is this just is PFI 2.0. So that's not going to land well with the politicians and potentially not with the voters, because that is just another way of mortgaging aspects of the NHS and then long-term payments that aren't good contract. But done well, I could see that money could come in, and then the NHS is a blue chip payer. We're here for a long time, so the investors get that small return over a very long period. We get the benefit of investment, and then we see energy efficiencies and carbon reduction. So that is one of the lights at the end of the tunnel that I'm hoping that the Greener NHS team can unlock with Treasury and Department of Health and Social Care. And Jim Mackey, the CEO of the NHS England, is working with Wes Streeton to do that. He hopefully will help us unlock some of those opportunities. We've got big potential there. And then getting back down just to the people you've mentioned, I would say we're quite lucky in a lot more teaching in engineering and in clinical space and scientists. There's more on the curriculum now around environmental impact and how within various sectors they can have an impact on that. So engineers can come up with solutions to some of the hospital's infrastructure challenges for net zero. Engineers like yourself like a problem and then want to be able to solve it. So how can we harness that energy, pardon the pun, to help with that? And that teaching is going to bring a wave of people through who are interested in it. And then it's really just around the politicians or the policymakers enabling them to be able to work on that. So a bit of money, a bit of capacity, showing that it's a priority, and it'll just naturally happen. We see it locally anyway. We have electronics and medical engineering or med physics colleagues, green champions who want to work to support the trust with the climate emergency strategy. And I'm seeing that more and more now. We've got over 1,000 green champions now at Newcastle hospitals. When I started, there was only 300 or so. And that's a good percentage out of the 16,000 staff. So, between now and then, 2035, see more people interested, more people having capacity within their organizations or nationally to work on it. And then we'll start to see, I think, transformational change. It'll not just be these incremental changes anymore. It can't be delivered by the low and environmentally sustainable kind of professionals in each organization, the small teams. It needs to be delivered by the scientists, the engineers, the clinicians, definitely.
Yeah, it's certainly got to be a commitment to everyone who works within the NHS to drive it forward. And like you said, there's an opportunity, I think, for large private organisations to be investing in sustainable practices within the NHS, because actually that comes back to them tenfold as a business if they can help to drive sustainability forward. It's going to be able to enable the NHS to do what it needs to do, and it's a mutual sort of supportive network then, isn't it, really, between industry and the healthcare service?
Absolutely. I've heard of some innovations that could be adopted much more widespread, but it's hosting fellows. So whether it's, engineers from the NHS going into the private sector to work in their labs and their workshops and taking that learning back, and vice versa. So, engineers from private sector coming in and working. There's inevitable red tape and bureaucracy in NHS and public sector that might make that difficult. But unless we're going to think outside the box and break those barriers down, then it'll just slow our progress and stop the transformation we can have. But yeah, again, great call to arms, Helen. If listeners and innovators want to reach out, there's actually innovation networks in the NHS that NHS England, Department of Health and Social Care pay for. So the Health Innovation Network. There are, I think, 14. I might be wrong on the numbers, but look that up. There's a network in each part of the region, and they are essentially funded by government to assist innovation, private sector, other trying to get solutions in and technologies, and they'll help act as that go-between between the providers who are inevitably underfunded and very busy, but then the market that wants to bring the solution. So Health Innovation Networks, definitely a good one to look up.
Yeah, well, I'll definitely put a link to the HIN website in our notes. So anybody who's interested in looking at the HIN network, it's definitely worth getting in touch with them and coming up with some ideas and sharing that with them. You never know whether there might be funding available to put forward the ideas that you might have. So yeah, I totally encourage people to get involved with that as well, James. You've kind of touched on this already, I suppose, but what 3 things do you think you could suggest that we could do to ensure the NHS reaches its goal of being net zero? You know, just the ordinary people, the patients, the supply chain. But what can we do?
The ordinary people in the supply chain. Well, Helen, that's everybody. So that's quite a challenge. Everyone's context will be different, but I think 3 things, try and make it broad enough. Well, first of all, I kind of frame it like education. So learn more about the situation. Now, that'll be different for different people. If you're a supplier, you should absolutely know about what the NHS commitments are, the targets, what that means to your business and, you know, your spend and your products and how you can work on that. And then wherever you're targeting, whether it be nationally with NHS supply chain, look on what their requirements are, reach out to Heidi's team, you know, if they want to score points on sustainability, they're a great resource. And then equally, if you want to go more locally via the Health Innovation Networks or reaching out to provider trust sustainability teams, just do your research, and understand the subject before you act, if you like. So I'd always recommend that. That's the scientist in us in the background. You know, what's your baseline? Appreciate that. That also works for patients and visitors. You know, it's one of the challenges we have, communication, is, you know, on information boards and other bits. If you're interested, have a look on the website, look on maybe their social media page, or while you're in the hospital as well. So find out what it means, and then that allows you to think about how you can help. And then number 2, it's like connection and collaboration, but I frame it as find your tribe. So I use this myself just to cope. The challenges and the context can be quite overwhelming at times. So I need to ground myself by meeting with fellow sustainability professionals in the NHS. I'm lucky enough to have a great team working with us, but also it's nice to have a whinge and a moan with other people from around the country who are trying to fight this fight as well. And also if they've had a success, they can tell you how, and then you're shortcutting that success hopefully into your organization. That's just human nature. So connect with the people who already get it. That helps your mental health, but also re-energizes you to be able to go and put that effort in elsewhere, as well as the benefits of collaborating and networking. And I will just give a shout out here, and maybe you can drop some links in, Helen. So there's 2 great organizations. When I was working as a one-man band and trying to find out and connect, Healthcare Without Harm are a global NGO that are working to reduce the environmental impact of healthcare. They were established in America, focused on mercury poisoning and pollution, because we still had them in BP machines and thermometers, and then the disposal was terrible and we were harming people. So it was founded in that, a great guy called Gary Cohen. And then they have different entities across the world. So Healthcare Without Harm Europe, must declare, I sit on their board of directors as a volunteer trustee, and they are trying to connect all of the different European health systems and people like me and doers and nurses and doctors to, again, expand sustainable healthcare across the globe. So they've got a global green and healthy hospitals network that anyone can join as an institution or an individual. So less so for private innovators trying to get in, but that's a great source. If you're working by yourself, connect with those. And then more locally in the UK, there's a great charity called Centre for Sustainable Healthcare. They've been around for a long time, very much focused on the clinical side of things. So when I'm talking about de-steaming and LED lights, they expect to stay at staff to kind of get on with that. but there's more carbon emissions embedded in our care pathways and the medicines and how we choose to treat patients. And they are fantastic. They offer really cheap training, if I'm honest. It's really accessible, and it allows clinicians and others who want to do work in this space. They've also got specialty network groups. It's all on their website, so if you could drop a link into them, that's a great shout out. We do, again, I must declare,
put that in the notes.
We do a lot of work with them. So currently we're hosting a Nature Recovery Ranger. How cool is that as a job title? If I knew that when I was
That sounds amazing.
So there's 4 in the UK that they pay for as part of their charity, but we host them. And we've only just done a bio blitz, first time, staff, patients, visitors last week to establish some biodiversity metrics. So they are awesome at hosting that service, and we've taken advantage of that. And they also host NHS Forest, which is tree planting in the NHS as well. Also brilliant. So
yeah.
I encourage people to look them up. So that was number 2, find your tribe. And number 3, this is the action bit. So just take action within your control. So I've called it active hope in the past. So if you're struggling or you're overwhelmed, just focus on what is in your control and what you can do. I didn't think I had much influence or control, but then when I was reminded by my wife that, we've got about 50, 60,000 tons of controllable emissions at Newcastle hospitals, and I was the head of sustainability at the time, maybe, it could make a difference rather than quitting my job and going to get arrested with Extinction Rebellion, which was the plan. So active hope. Do what you can within your gift, and then at least you're contributing and doing what you feel that you can. So some people will be able to do more than others, but if everyone's doing something, that should really help. So yeah, education, active hope.
Definitely. And I am so glad that you didn't quit and go and do activism, because what you're achieving or what you're doing at Newcastle is really setting the line for everybody else to follow. And I know that you're doing an awful lot of work up there, which is amazing. So thank you very much for joining me on today's episode. It's been a great pleasure to have you and to hear about your passion and commitment, but also the opportunities that there are for not just people within the NHS, but those of us who use it, those millions of us that use it every day, to really benefit from putting our effort into creating a sustainable healthcare service. So thanks very much.
Thanks, Helen. Pleasure.